Hello everyone. Now I'll be discussing question of cardiology. So we have a 57-year-old man. He come to you with progressive worsening fatigue, difficulty in concentrating, increasingly forgetfulness for the last several weeks. Right upper abdomen weight pain, discomfort, constipation, gained weight in the last 3 months. There's hypertension, non-ischemic cardiomyopathy with left ventricle systolic dysfunction is a past history, persistent atrial fibrillation. At the moment, BP is 160 by 100 high. At the moment, pulse is 58. And lung fields are clear to auscultation. There is no ankle edema. Skin appears dry. If we look into the report, lab reports, main thing what we are seeing is liver enzymes are mildly raised. Well, the question is, which of the following medication side effects are most likely responsible for this patient complaint? The answer to this question is amiodarone. Well, amiodarone is indicated for patients with serious ventricular arrhythmias, rhythm control in those patients with atrial fibrillation, underlying left ventricular systolic dysfunction, especially in the setting of systolic dysfunction. Like in our case, the question, patient is already a known case of cardiomyopathy and the patient has atrial fibrillation. Perhaps he was giving amiodarone and that has really resulted in control of the heart rate also. But don't forget there is associated bradycardia at the moment and hypertension is there. Well, the patient asks, this symptom are due to amiodarone-induced hypothyroid. What are the points which are favoring? Fatigue, memory loss. Look, he had a forgetfulness. Constipation, weight gain, dry skin, bradycardia, pulse 58, and hypertension is there. They are the two features which are due to hypothyroid. Okay. And he also shows signs of some hepatocellular injury because the liver enzyme, both the liver enzymes, the value is much higher. Well, when we are using amiodarone for a long time, it can induce multiple organ failures or disturbance can be, to be more precise, multiple organs are affected. And 50% of the patient, it's a huge percentage of the patient who are on amiodarone therapy can develop one or other side effect, and even the dropout rate is very high, 1 out of 5. That means 20 out of 100, 20% will drop out. They will not continue with amiodarone because of one or other side effect. So that is a serious concern about amiodarone therapy. Now, whenever a patient is on amiodarone therapy, you should monitor thyroid function tests periodically. Why? Because they can lead to both hypo and hyperthyroid. Like in our case, the patient of the question, the patient has developed all the features of hypothyroid. Hepatic function marker like liver enzyme are raised in this case also. Suspicious pulmonary symptoms should be evaluated with chest X-ray and pulmonary function tests. And some visual disturbance can also be there in this patient. So that means eye checkup should be done periodically. So periodically thyroid checkup, liver checkup, kidney and lungs checkup and eye checkup are some of the important things that you got to do periodic checkup. Now I got certain questions. Stop the video, write down the answer in your copy. What the most common pulmonary complication of amiodarone therapy? What the eye complication? What the skin complication that can be seen in case of patient on chronic amiodarone therapy? Stop the video, write down the answer. As far as pulmonary complication is chronic interstitial pneumonitis, eye problem, it can lead to corneal deposition. Skin complication, it can lead to blue-gray skin. I'll show you the photograph in the coming slides. So there are some of the complications that has to be monitored. Now the other option are digoxin is the B option. Digoxin can cause a lot of complications, like earliest are anorexia, nausea, vomiting, diarrhea. Nausea, vomiting, diarrhea, anorexia are the earliest side effect of digoxin toxicity. Confusion, visual disturbance can be there, and variety of arrhythmias can be there. Thyroid and hepatic function side effects are not seen. Well, I have got two questions for you. Stop the video, write down the answer. Digoxin toxicity can lead to all types of arrhythmias or blocks. Okay. Now there are two things which usually do not happen with digoxin toxicity regarding blocks and arrhythmias. What are those two conditions which do not happen in digoxin toxicity? Stop the video, write down the answer. Well, the answer is two things never happen. One is 2B block. Okay, 2B block doesn't happen, and atrial flutter does not occur. These are two side effects which do not occur in digoxin toxicity. Well, the option C is again not correct. Dafotilide is a class 3 antiarrhythmic agent, and the risk of toxicity point is up to 3% of the patient, and the side effect mentioned in the question, they are not the feature of dafotilide. Now again I have a question for you. Stop the video, write down the answer. Why there is increased risk of toxicity point is in patients who are on dafotilide therapy? Stop the video, write down the answer. The answer is this is a class 3 drug, and one of the class 3 drug feature is they lead to prolonged QT interval. So any drug which will prolong QT interval is prone to toxicity points. Hydralazine is an antihypertensive drug. It can cause salt and water retention, peripheral edema, palpitation. It can lead to orthostatic hypotension also. And a very commonly asked question is, it can induce drug-induced lupus like condition. Okay, well, there are at least more than 50 drugs which can lead to SLE like feature, but do not forget HIP, hydralazine, INH, procainamide. There are 3 drugs that you should never forget which are very, very important, which can lead to SLE like feature. Now I have one more question for you. Stop the video, write down the answer. There's something common in the metabolism of these 3 drugs. What is that thing common in the metabolism of these 3 drugs? Stop the video, write down the answer. Well, the answer is these 3 drugs are slow and fast acetylated. Okay, and this side effect is more common in those who are slow acetylated. Well, the next option E is metoprolol, incorrect. The major side effect of beta blocker is a beta blocker. It can lead to bradycardia, worsening of heart failure, bronchoconstriction, fatigue, depression, weight gain, and sexual dysfunction are the drugs which can lead to, are the side effect which can be done by the metoprolol. Again, stop the video, write down the answer. I have one more question for you. Recently, a new drug has been introduced, which act on the funny sodium channels. And this drug lead to bradycardia. What is that drug? Stop the video, write down the answer. Answer is ivabradine. Ivabradine is a new drug which causes bradycardia, and it acts on the funny sodium channels. Well, the golden line to remember, the major side effect of amiodarone, this you should know fully. Invariably, whichever exam you write in the world, you are bound to get a question on major side effect of amiodarone. It can lead to cardiac, bradycardia, and heart block. Pulmonary chronic interstitial pneumonitis is the most common pulmonary problem. Endocrine hypo and hypothyroid, very frequently asked question. In this question also, it was mainly of hypothyroid, but don't forget it can even lead to hyperthyroid also. GIT, elevated transaminase or hepatitis, that is more of a hepatotoxicity is there. Little bit of constipation can occur. Ocular corneal deposit and ocular neuropathy, optic neuropathy. Blue-gray skin discoloration you can see. And finally, peripheral neuropathy is the problem that can occur in CNS. So they are all the side effects that you should remember. Thank you very much.